Hi, good morning. This is Dr. Olmschner at the Ozark Chiropractic with you again. We're here talking this week about other topic I hope you find interesting and will be helpful to you. I always talk to patients, and this has happened lots through the years. You ever gone to bed, you wake up in the morning, and all of a sudden you've got this terrible pain in your neck. It's killing you. You can barely move. You barely turn your head. It just hurts. You know, people often come and say, I got a crick. I can't move my head. I can't do anything, okay? That's happened to people quite a bit. I've had it happen to myself, and I've seen hundreds of patients in the years have that same thing. So what is going on when we have this crick, or when we wake up and our neck is locked up, it's painful, we can't move? So let's talk about that. We're going to get our trusty spine out here. So what's happening is, for some reason or another, there could be a lot of things. We're not going to worry about that right now, but for some reason, your neck rotates out of alignment and the vertebrae will lock up. So you can have a vertebrae maybe rotate this way, that way, and it pinches that nerve and it locks up on that joint, so it becomes inflamed and very painful. So it hurts to move it, because whenever vertebrae is rotated out of alignment, it always hurts to move into that side. That's why sometimes you may notice that it hurts more going one way than the other. So what's happened is that vertebrae is rotated out of alignment, it's pinching nerves, there's swelling, there's pain, and you don't feel good. So what are we going to do about it? Well, oftentimes patients sometimes will run off, get medication, things like that, take aspirin, think it's going to help it. Not really. It may give you a little temporary relief, but it's not going to help correct the problem that caused it. And that's what we have to do. So if you've been a patient of mine before, you've had issues with your neck, we know what's going on. So oftentimes we'll go in gently, because patients are oftentimes a little hesitant. They say, well, I don't want to get hurt. I don't want to be hurt more. Okay, I get that. We don't want you hurting more either. But I want you also fixing the problem, and ignoring it's not going to get rid of it. So oftentimes what we'll do is, on checking the spine, we're going to see what you can tolerate. We have an adjusting tool where you can use our activator. That's for adjusting the neck, and that's a very low force, very easily tolerated. And I'll just go in and see what the patient can tolerate, because a lot of times they'll tolerate more than they think. And once we get that adjusted, that frees up that space, gets that pressure off that pinched nerve, reduces the swelling around the joint, and the pain starts to improve. We also then can do therapy, which helps further to decrease the pain, get the healing going. I'll have you use ice at home, gently work on some range of motion and things like that. But that's how you want to handle a crick in the neck. Ignoring it is not going to help anything. It just makes it worse, because when you ignore problems, and over time, it will heal on its own, but oftentimes it's going to heal poorly. So it's going to leave you more prone to having further problems down the road. You're going to have less motion, more pain restriction, and it's going to cause greater issues that way. So that's why it's so important to take care of these things. So if you wake up with that crick in the neck, quite simply, it's the vertebrae out of alignment, pinching the nerve, causing the pain, and that's what we're here to correct and help. And we see hundreds of patients with these things throughout the year, and they do really well with care, and I know you can too. So if you're suffering that, take the step, call us. Don't sit there and just deal with it, because it won't go away. And especially if it lingers after a few days, 2 or 3 days, get help, all right? On another note, we are ready to start doing blood work now. We've got everything in place, so we're going to start being able to start drawing blood. So if you have needs, if you just want some simple blood work, if you want to test or things, talk to us. We can help set it up. And then we can run your insurance. We'll have cash pay for folks and things. We can go through Medicare, Medicaid. The lab comes, will take care of that, so we can help you along that way. And definitely with the functional medicine part of things, where we can help you evaluate and see what is going on in your body and what needs to be done to help address any issues you have, whether it's managing sugar, thyroid issues, weight loss, energy, sleeping, diet, digestion, all sorts of autoimmune things. So these are all things that we can look at and help you with too. So that's exciting there. We have our holiday coupons out in the flyers now and around. You can share that with your friends or neighbors, help those people out. It's getting to be summertime. We're getting warmer again. So I want to wish you guys a great day. If you ever need anything, give us a call at 479-667-5053. Check out the website, like us on Facebook, and until next time, you have a great day. Thank you.